So that's what we got. Let me start by talking about SAW, and I'll give you some backgrounds. When Division of Behavioral Health and Recovery, or DBHR, is where I work. We used to be over at DSHS, or the Department of Social and Health Services, and they moved us to Healthcare Authority. They said, well, it's important that we integrate behavioral health and physical health, so we're going to move you to Healthcare Authority. And that's largely a good thing. And one of the things that we learned when we came over is that the Healthcare Authority folks looked at BHAS and says, where's your multi-factor authentication for getting in? And I said, what? And they said, well, that's really a requirement for data security. And so we started working on improving security. And at that time, MFA, or multi-factor authentication, was a new term to me. It probably is not a new term to you. I got the same thing from, I think, my Google account saying, hey, you got to have multi-factor authentication to get into your, your Google Gmail account. And so this is something we have worked on for some time, and I think you guys know why we're doing it. You've probably seen cities and the utilities and other important things held hostage to ransomware, and other kinds of nefarious activities that go online. And I just want to remind you of what you already know. The information that we deal with is the highest category of sensitive information that can have. It's public health information, or it's personal health information, or PHI. And it was what we call category 4 data. And so it has a high value on the black market, and bad actors will try and get it. And so we need to do everything we can to make sure that our system is not compromised. And we always trust you to be sensitive with that data. And we're also putting in measures in place in our BHAS system to make sure that that system is secure as it can be. And part of that is this multi-factor authentication. So we're using Secure Access Washington, or what we call SAW, as our front gates to do that multi-factor authentication. Many of you are already familiar with SAW. And if you have a license as a therapist, if you got unemployment, if you got child support, you already know what SAW is, because it's already used for those kind of things. So some of this you're going to find is not that unusual to you. And so here is some information. This was in the invite. It's about how to access it if you already have a SAW account. And what you'll see is that you're going to go into SAW and you're going to want to check your email. The primary email is there in that account thing. I got the little arrow there showing where it goes. And you'll see, it'll come up and it'll have your primary email. This is the most important thing about this, is that that primary email has to be the same as what your BHAS account shows. If it's not the same, then it won't work. And so you're going to want to check your SAW account and make sure that that primary email is the same as what you've got for your BHAS account. And you probably need to go into BHAS and check and see what your email is so that you make that match. Now, later on, after you make the connection, you can change that. For my SAW account right now, I have my personal email. It's a Yahoo account, is my primary. And once I made the primary email connection and logged into BHAS through SAW, and it said, okay, we made the connection, then I could change my primary email back to my Yahoo account, and I left my my Healthcare Authority, or HCA account, as a secondary email. And you're welcome to do that. But to make the connection, you've got to have it as your primary email. So you'll need to do that. The other thing you got to recognize is that some people have found that making that connection took overnight. And that was a surprise to me, but it seems to be that case. So let's go on to the next slide. So you'll see there that you got an additional email. So that's where you can, after you're done, you can put it as an additional email, or you can leave your BHAS email as primary and put your personal email as an additional email address. The reason you have a mobile phone number there is that every time you go in it's going to give you this code to get into BHAS, and you can either have it sent it to your email or you can have it sent to your phone number. So if you prefer to have it sent to your phone number, you're going to need to have your phone number put in there so that it can send you a multi-factor authentication or MFA code. So there are instructions there for how that goes. And right now I've got too many things. Okay, so this is the BHAS login. What you need to know is that as you're going into BHAS, don't go into the SAW. Like, you know, if I'm just going into SAW, I'm going to Google SAW and you know, secure access Washington, go there, and it'll say, do you want this app or that app or anything? And we don't have it set up so that that works that way. So you're going to see a URL there. This is https://sso.wa-bhas.org. That's the URL you need to have. And so take that, put it in your favorites, and that's the way you get in. So when you put that in, you're going to automatically, you know, SAW's going to say, all right, it's Paul, he's coming in and he wants to go to BHAS. And so we're going to let him in. And it's going to say, we're going to send a multi-factor authentication code somewhere. Where do you want it to send it to? And it'll give me these three options. Do you want it to send it to this email, that email, or your phone? And it doesn't matter which one you choose. I usually just have it email my work account because I'm working from work if I'm doing BHAS, but it doesn't matter where you send it. It sends it, and then you get that code and you put it in. And down below there, I think it says, are you going to use this computer a lot? And it doesn't matter if you say yes or no. You have to do that MFA every single time. And so I stopped clicking yes. Do you want us to remember this? Because it doesn't matter. It doesn't hurt if you put it in there, but it doesn't really help. So you put the code in, hit submit, and it's going to take you right to BHAS. And what you'll notice is it takes you past the username and password place right into the front page of BHAS. So that is the way that you get into BHAS, is from that front end. And this is your new way in. If you get an error at that point, then you're probably going to want to put a help desk ticket in, and we'll help you figure it out. There's going to be some of this. And I'll tell you that we are, I think, the first agency, first of all, the agencies to do anything through SAW as a front end. And so there's going to be bugs. This is new. We tested it a lot and we got over most of the problems, but you know, anytime we do something new like this, somebody's going to have a funky thing. What I will tell you is don't use Internet Explorer. I think that's going to cause a problem. Many of you know that Internet Explorer is not supported anymore. And Internet Explorer for Healthcare Authority is still the default on my computer, and I'll bet it is on some of your computers too. So it's really time to talk to your IT folks and say, how do I get something besides Internet Explorer as my primary primary browser? And Edge, Firefox, Chrome, all those are fine as long as you get something that's updated. But Internet Explorer is probably going to cause you problems if you do this. And so this is a good time to make sure that you're not using an outdated browser, because some of this functionality is going to cause you a problem. And I won't pause at this point. We'll have questions later after I go through everything. So if you got a question, jot it down. And you could even put it in the chat. I'm not able to see the chat because I got too many screens open, but I trust that we can look at that later. So I'm going to talk about some new features once you get into BHAS that are going to happen. Oh, actually, let me go back. Right now, you can do either SAW or you can go to www.bhas.org, wa-bhas.org, and either work. We're going to close down the username and password probably by the end of the month, so that the only way in is SAW. So we're going to give you a couple weeks to make sure that you can get in through SAW before we close that down. So make sure that you try that and that you get it done. And if you got problems, you're letting us know, so that you know, when we get to February, you're not locked out, because we don't want you to have access. So many of you have already done this. Some of you have already overcome some problems, but I'm anticipating by the beginning of February, we're going to close down the way you get in right now, and the only way in will be through multi-factor authentication. And so that's really important. So now we'll talk about these new features. Once you're in, another thing that we're ready to turn on, it's in user acceptance testing, and we're ready to put it in. This is going to happen, I think, next week, is that as you do a new client or as you do a new CANS, we're going to ask about sexual orientation, gender identity, and race, ethnicity, demographics. And this is really important. You think about some of the conversations we've had for a number of years about disparities and how there are differences in outcomes in all kinds of things. Whether it be being arrested or, getting a job or getting housing. Another one is getting access and results from behavioral health services. And without understanding outcome data, we can't make any improvements. And so we prioritize getting some data about these demographic pieces so that we can say with a fair amount of certainty, do young African-American males have a different outcome than white males in terms of getting out results from WISE? If we don't ask these questions, we don't know. Or if you're lesbian, do you have a different outcome than if you're straight? And all that kind of information allows us to make adjustments to how we're delivering services so that we get the outcomes that we're looking for. We can't know if there are disparities if we're not looking for them. So this becomes very important. And that's why we prioritize putting this in at this point. So the new fields are gender identity, transgender identity, sexual orientation, and race and ethnicity. There's information that are going to help you ask questions. Remember, as you're doing CANS, it should not be a checklist as much as you can get away from that. It ought to be a conversation, and hopefully you're able to have that conversation. And I know when you're doing a screen, it's a little different. I do screens, and it looks a little bit more like a list. But we're going to trust that you've got the sensitivity to have these questions and do them in a way that's respectful and meaningful, and gets us the information that we need, and lets the person be identified how they want to be identified. Those are the two things we really want to do with this, is we want to collect enough information to identify disparities and eliminate them. And at the same time, we want to have people feel like they are represented and that they don't have to be outside, in a box that they don't fit in. So that's what I think we've done a good job of starting it. We'll probably, learn some things as we go along. But the information that it's asking for is going to prompt you to get a level of detail that's fairly high. And so you're going to want to ask probably a little bit of probing questions about these demographics. Like I said, that'll allow us to address the disparities that may be there and give a more comprehensive list of demographic items. So if the client is new, it's going to require you to fill in those fields. That you can see sexual, gender identity, transgender identity, sexual orientation, race, and ethnicity. So they're there, and we'll show you a little bit of detail. If you're updating a current client information, just hit edit, and it'll allow you to update those fields. They're going to be there. If it's an old client, it'll be blank, and you're going to need to put information in. If it's new, it'll be blank, and you're going to need to put it in there. So here's the gender identity stuff. And this will be one of them, and you can see that there is a longer list than we used to have. So you can check female, male, I'm not sure or undetermined, not binary, I don't identify myself that, I choose not to identify, or I prefer to self-describe. And you'll see down there that if you put prefer to self-describe, then there's a comment box. You'll also see that it's not required if they're under 13. So there you go, gender identity. You can actually select multiple items. And then for the bottom one, you'll see there, sexual orientation. I'm sorry, do you identify as transgender? No, yes, don't know, or I choose not to disclose. And you choose one of those. You don't get to choose multiple of those. Here's sexual orientation. This is the one that's if you're under 13, we don't ask about it. And so it won't come up if it's under 13. But if the kid is over 13, then you'll need to do that. And again, it's got the option of a self-description if that's how the youth wants to, and they don't feel like they fit in a box and they want to tell you about it, then you can put it in there. For race and ethnicity, you're going to choose a category. You'll see that the drop down is going to have, it's going to come down there. And you need to choose a subcategory. When we had discussions with this, we decided that that was pretty important to have some subcategories. So you're going to see, like in African American, it's going to have a lot of different options. And the important thing is, if you're going to deselect a category, you're going to need to uncheck all those subcategory options. I learned that, and so that's an important feature you're going to need to know, and you can play around with this. At first I thought it was broken, and then I learned, oh, you got to uncheck all the subcategories to uncheck this category. And if something doesn't fit in a box, there's a comment box. So I think about myself as white. I don't really think of myself as being English white. I just think about myself as being white, and it's going to make you put a subcategory in it. And so you can just put white, or you can put American, doesn't matter, whatever this person chooses to self-describe them as. We're going to use this data to make adjustments to those drop downs in the future. And we recognize it's not perfect, but it's a good start. So there's what it looks like. You're going to see for this one, we chose Hispanic, and you can see that there's a lot of different choices. You see Puerto Rican, Mexican, Cuban, Salvadoran, Dominican, Colombian. And so if I was going to say they were Salvadorian and Dominican, I could check both of those. And then if I say, oh, no, that's not right, I'd need to uncheck Dominican and Salvadorian before it lets me uncheck Hispanic, and then I could go to a different category. So the subcategories are like Salvadorian and Dominican, and then the category there is like Hispanic, Latinx, or Spanish origin. So that's how that works. And if it's not in the subcategory, you can put not listed, and then you can write in what they want. Just like what I said, I just identify as white, and that's how I want to be identified. So it wasn't there, and you wanted to put English, so you can just as a subcategory put in as white. Make sure you hit the save button once you completed that demographic information. For your clients that 3 years ago working with them, you don't need to update those. But if you're going to update a CANS or put a new client in, then it's going to require you to do that information. Just don't worry about the old ones, only new information. Now, if you're an agency administrator, you can pull those fields in the data extract file, and you can see that there. I'm just going to remind you that that data extract file is chock full of personal health information, so treat it with the respect that that kind of information needs. But it does allow you to look at all of the comments too, and not just the categories, but if somebody has a lot of things that they wrote in there, it would allow you as an agency to see this is how that person identified, and not just the categories. So the next thing that we're going to put in is birth to 5. Kiki, are you able to talk?
Yes, I am. Can you hear me okay?
I can. So I want to introduce folks to my friend Kiki. Kiki's been, how long you been with this? I'll bet it's longer than
longer than you think, 15 months now.
Yeah, so Kiki joined us 15 months ago. We've never actually met in person, but we've talked on Teams an awful lot. And she actually is over on the East Coast in Boston, and was hired into the COVID time, so she didn't have to move here. But we've worked very closely on birth to 5 stuff. And is Christine on too?
Christine wasn't able to make it.
Okay.
Christine Cole. Christine, I think Christine Mickelson is here, but
yeah,
Christine Cole is not.
Cole is not. So Christine Cole also works with us on the early infant and early childhood mental health stuff. And so Kiki and Christine have been very influential as we have made some updates to the CANs, and they have been working very hard. And I think they just had a webinar finish that I wasn't able to join. But many of you know that there's this new thing called DCO5. Kiki, do you want to say something about that?
Sure. And, there's a lot of detail about this, and happy to chat with people offline or share links to the webinar that we just finished. But basically, the DC 0 to 5 is kind of like the DSM, but for kids younger than 6. And Apple Health or Medicaid, not just WISE, but all mental health services have some new policies for when we're doing mental health assessments or intake evaluation or intake exam, whatever you call it, for those young kids, so younger than 6. So if you're interested in learning more about how you can get enhanced reimbursement for those services and the new rules and regulations for that, I'll put my email in the chat, and we can also see if maybe there's some way to share a bulletin out with folks who are interested to learn more about that.
Sure.
And there's another slide later that will talk about the first WISE Birth to 5 webinar that we're going to have. I think it's actually next week, which will go into more detail about this as well.
Right. And what I wanted to point out, Kiki, is there's a reason we did this. With the DC-05 coming in place, it's a DC-05 and not a DC-04, right?
That's correct. Bingo, bingo.
And so Kiki says if it's a DC-05, we really need to have the cans reflect that it's up to 5 and not just 4. And so that meant we had to make a few changes. And I asked Kiki, as we're making those changes, please don't make changes to BHAS. You can make changes to the directions, but don't make them to BHAS because that's hard. And so she was kind enough to work with me and humor me on that. And so what you'll find is that there's a lot of new information in the, that we've actually got posted in BHAS about how to answer the questions that I think is just additional to what it was. And the other thing is that once a child turns 5, you've got a choice. And so you'll see that. But back in the old days, once a kid turned 5, you had to use the 5+. And now, between the time that a child turns 5 and the 364th day after that, up to right before they turn 6, you can choose either the birth to 5 or the 5+. It's important to know that once that child turns 6, you're going to have to use the 5+. And Kiki and I and Christine had some long conversations about how to deal with that, but that's where we landed, is that we're not really given any leeway on that, so that once they turn 6, you have to use that 5+. So if you get close to it, you're going to have to think about how do you get that in on time so that you don't have like something on paper that doesn't match, because there are some differences between the birth to 5 cans and the 5+, and they don't necessarily translate over. So if you get somebody that's close to turning 6, you're going to want to think about, well, which one should I use and why? Want to point out that doing that birth to 5, there's nothing that prohibits you from doing that if you're not certified in birth to 5, but we really recommend that you become certified in it, because there's some really, I think, critical differences in how you do them, and some differences in, like obviously sleep looks a little different, sexuality certainly looks different. There are some things that are, I think, a little different about doing a CANS for a birth to 5 than you do for the older kids. And so we recommend that you get certified in that birth to 5 as well as the 5+, knowing that that's more time. And if you're going to be providing services to those young kids, you're probably going to want to not practice outside your scope by not giving the training that you need to ask the right questions.
And I will say that PRAID has updated the TCOM training. It used to say 0 to 4. Now it does say 0 to 5, and has our updated reference guide and rating sheets on there. So you'll see, if you decide you do want to, the materials haven't changed, but if you decide you do want to do that early childhood certification, you'll see that change on the TCOM website as well.
Great. So I'm going to show you what it looks like. And there you, I think for this kid was, we put in a test kid and made them 5 years and 3 months or something like that. And you'll see that you got the choice of doing the birth to 5 or the 5+. And so remember that you have the choice, and we have not changed something that has been in the past, that for the birth to 5, you won't have an algorithm. And for the 5+ you do. So Kiki's got a nice graph here. You want to talk us through that, Kiki, if you're able to?
Sure. So this is similar to what Paul shared, but we do recognize it is a little confusing that there's some changes and there's some flexibility. So if a child is birth through age 4, so they haven't turned 5 yet, you're going to use CANS birth to 5. You won't have an option. If they're age 5, so from their 5th birthday until their 6th birthday, that time period, that 1 year, you can choose whether to use the CANS birth to 5 or CANS 5+. Once the child turns 6, through their time in WISE, you won't get a choice. You'll have to use the 5+. So hopefully this visual is, I'm definitely a visual learner, so this little graph was helpful for me for keeping track of this. And like Paul said, just a reminder, there's no algorithm for CANS birth to 5. So it doesn't necessarily matter the age, if they're 4 or 5, it matters what tool you're going to use to do the screen, whether or not you get an algorithm. And if you're doing CANS birth to 5, there's no algorithm, so it's up to your clinical best judgment to decide if the child and family is the right fit for WISE.
And if the child is 5 years old and you choose to use the 5+, it will throw an algorithm there. And remember that you can always override that clinically if you decide that it needs to be overridden. Okay, the demographics information. Kiki, can you walk us through what's required and what's not? I think the only one that's not is just the sexual orientations, who they're attracted to. The rest of them we still require, right?
That's right. Everything is required, but like Paul walked through, there's the options to say prefer not to self-disclose or say I don't know. So just because you have to give an answer doesn't mean that the answer has to be affirm this is what what the child or youth identifies as. But like Paul said, sexual orientation is not required for birth to 5 because that will be for children under 6.
Yep. And not only is it not required, I don't think we can even put it in.
Oh,
I think, yeah. So I don't think it allows you to put it in. The reason we want to do gender identity, a few years ago, this probably would have been a mystery to me. And then I had a friend who had a child and had ambiguous genitalia, and and that happens. And so sometimes it's not entirely clear if the child is a male or female. It's fairly rare, but it's not unheard of. And so this is an important thing, especially not just for the older kids in terms of gender identity and transgender identity, but even for very young kids. And I'm very sensitive to that based on one of my friends' experiences with having a child that it wasn't really clear what the gender was based on the sexual genitalia.
and aren't born intersex. We do know that there are young children that do identify as trans or non-binary, no matter what they are biologically identified at birth. So that's why it's important to ask about gender and transgender identity for these young kids. And they also might not know, and that's totally fine.
Yeah, and this doesn't have to be a long discussion. We don't want this to be an inquisition, or an interrogation. What we want it to do is be affirming to the parents, and we want it to be sensitive to it. And we know that we are asking you to do, I think some crucial conversations, and we trust you to have those clinical skills. And if you don't have those clinical skills, work on them. I was a clinician back in the day, and starting to ask those questions took some clinical supervision for me. If it takes it for you, that's fine. Kiki was good enough to work with me to make sure that we've got all of the new guides and rating sheets on BHAS. You can see they're on page 2 right now. And so when you get to like page 3 through 7, that's mostly outcomes data by agency. You're welcome to look at that, but she's got them there on page 2, so you can see them there.
And those rating sheets do include the new sexual identity, gender, transgender, and race and ethnicity questions on the rating sheet.
Thanks, Kiki. Okay, and we're saying, once again, the BHAS items have not changed. The directions are there. And as Kiki was mentioning, we have a webinar that she's doing coming up next week. Anything else you want to say about that, Kiki?
I'll just say a little bit about what the webinar is going to cover. We're going to have Christine Cole come and do a great presentation about introduction to infant and early childhood mental health. So whether you work with young kids or you've never worked with young kids and want to know what does it even mean for a 2-year-old to have a mental health disorder, there will be a great intro to that. We'll go over some of the new Medicaid policy changes for DC 0 to 5. We'll talk about this new CANS reference guide that has new developmental milestones and new information. And we'll also talk about something that we're going to be doing starting in January is a WISE Birth to 5 provider call once a month. So that call is just a time for WISE practitioners, agencies who are serving young kids to come together and talk about how they're finding the work, whether things are going really well, if they're hitting challenges, and want to debrief that with each other. So would love to see you guys at the webinar on January 13th, and you'll find out more about those provider calls soon. I think we have about 50 people registered so far for that webinar on the 13th. So very excited for that.
Yeah, and again, this what's called infant mental health. I remember the Friday afternoon when the call came in and said, "What are you guys doing about infant mental health?" And I'm like, those were 3 words that I'd never heard put together. And it wasn't that long ago. And since then, I've been on my own journey of understanding what we're talking about with infant mental health. I had to go into David Reed's office and say, "What are they talking about?" And so we, that's kind of been the birth of it. And then we ended up getting some pretty good providers that are actually have some expertise in it. I've learned a tremendous amount about it, and I would encourage you to learn that too. Anything else, Kiki, before we go to the next slide?
I think we're good. Thanks for having me, everybody. And for those of you I haven't met, nice to meet you.
Yeah. All right. Some reminders. BRS and CANS it's an important thing. BRS is recommended by the DCYF staff. So before you choose saying BRS, make sure the DCYF staff says that's what we want them in. It's not our choice that they go to BRS. If they're going to go to BRS, we are able to say, well, we can get WISE with it too. But it's not our decision on whether they go to BRS. That's up to the DCYF person. So make sure you consult with them before you put that in there. Once a youth is in WISE, you don't need to be doing any new screens. And sometimes the DCYF workers are a little fuzzy about that. But remember this, the screen is to determine eligibility to get into WISE. We never want to do a screen once a person is in WISE. We don't use the screen to show us a time to get out of WISE, and we don't do the screen just because it's fun. It's really just to determine, is this a good fit? And that's the only time we do it. Just do the full CANS every 90 days once a child is in WISE, whether they're in BRS or not. And if you run into any problems with that and there's some confusion, feel free to loop us in on the Healthcare Authority side. We're happy to talk to our friends at DCYF. They have new staff that come on. Conflicting messages, we're happy to work through any of the messaging like that. Next step, our next issue. It's not uncommon to have a youth move from one location to another. And I found out how uncommon it is. I just looked at the data. Christine Nicholson and myself and Caitlin Morse do those transfers. Last calendar year, we did 1,100 transfers. That's a lot of kids that move from one WISE provider to another. That's just in 1 year. So remember that as somebody moves from one location in the state to another, or even, say they're over in Spokane and they say, you know what, I didn't like my experience with this provider, Excelsior didn't meet my needs, I'm going to go to Frontier, and, and stuff like that happens. It's why we have a choice of providers. Then we're not leaving WISE. Don't do a discharge if they're just moving. What you need to do is make sure that the new agency is going to put the request in. We transfer them, but don't do the discharge CANs. In the case where you kind of lose track of a kid and they just kind of disappear, you can take that 90-day CANs and later, through an administrative discharge button, turn it into a discharge. But once you do a discharge, then it's a data change request, which is more of a hassle. So you're going to want to err on the side of not doing a discharge if you don't think, if you're not sure that they're actually leaving and that they're done, and you can change it to a discharge later. Once you do a discharge, then it's kind of a hassle to change it into not a discharge. And again, if a youth is on the interest list, meaning that they have screened into WISE and you don't have room to put them in WISE yet, don't do any additional screens. Once they're on that interest list, it's it's not something we want to do to put the family and the youth through the stress of saying, well, I don't know, what if they don't screen in this time? And so it's important that we don't do additional screens. Once they're on the interest list, they've already screened into WISE, and even if it's months down the road, we don't need to do another screen. If you're requesting a transfer, this is really important. I just pointed out that we did 1,100 transfers last year. And so if you give us the information that actually needs to be there, then it makes it go quicker. Put the name of the youth. The provider one number makes it easier, because if it's Paul Davis, there might be several Paul Davises, but there's only one provider one number. And so if you put the provider one number, it makes it easier for us to find it. It's really important that you have the current MCO, the managed care organization. Or if you look it up in provider one and it doesn't show that there's an MCO, it probably means they're fee for service, and note that it's fee for service. If you're at Excelsior again, you're going to say, I need this kid to be transferred to Excelsior so that I know that it's Excelsior. Let them know what county it's into. Excelsior is just Spokane, but there are some other places like Misty, with comprehensive, to tell me that if it's in Yakima or Benton or Franklin or whatever. And it's useful to know the person that's asking for it, because the user, the person doing CAMS, is one of the fields we fill out. So have those, make sure it's in a secure email. If you don't have access to a secure email, say I need to do a transfer, and we can send you a secure email and you can respond to that secure email, but it's important to do that. And if you've made a mistake, you need a change, you're going to need to do a data change. You're going to send it either to me or to the WISE support. If you're actually doing a transfer sorry, I got a call on my phone and it messes things up. Anyway, make sure that you use that WISE support. That means, like, if I'm not there, that it'll go to the support inbox and it'll get taken care of rather than sitting in my inbox. Closed pending is something that predates me. And so there's this thing called closed pending. Don't use it because it's not really pending, it's closed. And so I don't encourage you to use it. If you need to have your CANs approved by your chain of command, just wait and before you get it to that closed pending, and have them say, yeah, that's okay. Because once it's closed pending, you have to do a data change to change it. And so it's one of those things that, when we get time, we'll probably remove it, but we've had these other things that kind of went in front of it. And so the closed pending is still a thing that's not very useful, so I don't recommend that you use it. Finally, you do the hard work. The work we do, I think, is important at the state level, but you guys are doing the hard work. We want to make sure that you're getting the support you need. So if you're running into problems, get help. Put a help desk ticket into the BHAS help desk, which is that first one, or our HCA help desk, which is the HCA email. And if you don't hear back in a day, poke us. It's okay. Sometimes those emails get lost, and and I've been guilty of that. And I'm not, I don't feel like that's inappropriate at all. If somebody says, hey, I didn't hear back from you, can you help me out on this? So that, I think, is the end of my slides. And we still got a few minutes left. So we got 12 minutes that I can answer questions. I believe you can all unmute yourself, or you can put things in the chat box. Let me see if I can stop sharing my screen so that I can see the chat box. And Jen, do we have anything in the chat box? I haven't looked.
Please leave a short message with your name, date of birth, and a date.
We do have quite a few things in the chat box. Let me look through them.
Okay. 48. Okay, there's a few.
I know while Jen's looking at the note, there was a specific question about if you didn't get the message about registering for the WISE Birth to 5 webinar, please send me an email. I'll put my email in the chat. It's kiki.fabian@hca.wa.gov, and I will connect you with the en route team to make sure that you're on their email list.
Great.
And they can also share the registration link via that email too. So looking forward to hearing from folks.
Yeah. So let me go through these as much as I can. Nikki, I'm getting an error message when attempting to log on in through SAW. Not sure what's doing wrong. That's one you're going to send to the BHAS help desk. We look at those every Friday to see what's going on. So if you're getting an error message, send it there and we'll follow up. Debbie's asking, when does it go live on the SAW website? It's already live. What's going to happen is that the old place is going to shut down probably by the end of the month. Ashley says, the documents in SAW BHAS are only showing up for age 0 to 4 age. Do we know when the 5+ documents will become available? Oh, I think that's mine, Ashley. I think I need to do some updates on those and move them around. So give me some time and the 5+ haven't changed. I think they're probably at the end. So check page 8. They're supposed to be there, but I'll do some checking on that. Thanks for letting me know that. So I had a kiddo go to Walla Walla after an intake with a referral to WISE. You're saying we do not do a discharge camp. Exactly, Winell. Don't do a discharge. Just do what, like if you screen them and they're going to Walla Walla, that's fine. Walla Walla should be asking. Teresa says, what if the area the youth is moving to has no openings at the WISE in the time? Doesn't matter. If you know that they're not leaving WISE, then don't do a discharge. If we find out later they just kind of disappeared, that they don't want WISE, then we can change the last cans into a discharge through the administrative discharge function. Ashley says, for youth that aren't in WISE but are in BRS, do we still need to complete the CAN screen every 6 months for their contract? Yes, we do. If they're not in WISE, they're still required to do a WISE screen every 6 months. That was a settlement agreement component, is that if we have a kid that is not in WISE and they're in BRS, we need to do them every 6 months. Wendy, I see her there. I didn't get that wrong, did I?
Nope.
Okay, thanks, Wendy. Thanks for being here. How do we register for the webinar on the 13th? I think got that. There's a chat bot feature within SAW, also email support, WATEC. Okay, thank you, Joni. So that's really important. If you're having a problem getting into BHAS through SAW, it might be on the SAW side. I don't think it's going to be. I think it's going to be a mismatch in emails. That's probably what it's going to be. You can try the support WATEC. So that's there too, if you're having trouble with just SAW. Sometimes it's hard to know if it's a SAW problem or a BHAS problem. Most of them have been a mismatch in email. Is there a help desk SAW? That's okay. Looks like Susan was asking. That's why Joni put that in there. Will physical HCA CAN screen and CAN's full form be updated to include these fields? Oh, that's going to take some time, Ashley. Can you share the list of demographics again? Oh, that's kind of related to the slides that we just did are on page 2. So the list is there, and you can actually go in and look at it too. Summer's asking, what about the youth that do not want their parents to know about their gender identity and sexual orientation? So that's going to be I think a sensitive conversation with that child, is saying, I need to put something in here. What should I put? And I think that's a good further conversation. I don't want to be too flippant with that because that's a really sensitive one. Matilda's asking, would this interrupt us from being certified in CANs? Absolutely not, Matilda. Not going to make any interruptions there. Didn't catch the URL for that, for getting in through SAW. It's in the slides. SAW does not allow the deletion of old accounts. Yeah, so you can't delete an old account, and you can edit it. The reality is, I remember when I was over at DOH, I had a DOH email, and I couldn't access it anymore. I had to make a new SAW account, and I didn't have another way. Cassandra's saying the help desk icon will not open for me. Sorry to hear that, Cassandra. And in that case, there is a website, and I've got that at the last slide. And so just use that WABHAS help desk If you have several logins for SAW, can we delete one of those old accounts? So that's what, Susan, that's what Joni was saying. Nope, you can't delete an old SAW account. Just choose one and stick with it. How do you change email address in BHAS if you're not using your work email for SAW? So you're gonna wanna have, don't put it like a Yahoo email in BHAS. You want your work email. So this was, I think, one that we, and this is from JL Erickson. Okay, so for me, I was, they were laying us off a day a month, and so we had to collect some unemployment, and they told us use your personal email for SAW. And so my primary email was my Yahoo account for some time. When this SAW thing came out for BHAS, I just changed my personal email to a secondary email and put my HCA account as a primary. Once the SAW connection was made, I switched it back. And so now my Yahoo account is primary and HCA is secondary. So that's, I think, the best way to do that, rather than changing your email in BHAS. Make sure that your email in BHAS is correct. So check it, and your agency admin can change that if you find that it's incorrect. You can also send it to us through the WISE support at hca.wa.gov, and we can change it if you've got a problem with it. And Joni's answering a question. At this time, you can only access the BHAS via the URL. Yeah, so there, I think what Joni is saying, and I'm sure we'll see this, but when you go into SAW, there is a place saying, do you want to choose from a list of apps? And we don't have BHAS added yet, so please just use that that SSO, and it's there. There is https://sso.wa-bhas.org. You got to use that for right now. We're working on the other entry. I'd use my work email, which is the same as BHAS, but it does not show any services connected to my email. Yeah, Cassandra, try and make that work. Just check your email addresses. If it still gives you a problem, then shoot it into the help desk. Let's see. So if you don't have your work email linked, you need to change it. Yes, in SAW, you need to change it. Since we're moving to SAW, technically, would we also be saucers? Absolutely, we are saucers, and BHASers. And let's see if we got anything else. Watch out for cougars, they lurk in the snow. Thanks, Katie. We know that cougars are in the snow. Let's see if I've missed anything. We got about 3 minutes left. So
hey,
this is
Paul.
Go ahead, yeah.
It's Katie. So I wanted to piggyback off of what Teresa mentioned in the comment chat, her question about if a client transfers to another WISE provider who doesn't have an immediate opening. I think the question is more along who is going to provide services while that youth is waiting to have an opening. Is that the other provider who will continue to do telehealth, or what is that looking like? Like, what is the expectation around the state with that?
Okay, and to be clear, this isn't a BHAS question. This is a service question. And
correct.
It's an important one. Yeah, and I think that's probably a discussion you're going to want to have with the family and with the other agency. And it's a real thing. We know that we've got way more people interested in services than we got services available. And so you're going to want to say, all right, so you're going to Clark County Catholic Community Services, and they've got more people on their list than they have access for. And right now, you know, they're not going to be able to get you in. So how should we provide services? And I don't think we got a blanket answer for that. Jackie, are these new demographic changes on the CANS assessment itself or on the client profile? It's in client profile, Jackie.
Hey,
And, oh, go ahead.
Sorry, I have a couple of questions and I'll try to make it quick due to time, if that's okay.
Sure.
So when we end the location for our agency, does that suffice as kind of closing the profile in our location and allow other agencies to access it? Or do we still need to do a transfer request?
No, that's great. Okay, so the kid is leaving your agency, right?
Right.
Yeah, and so, yeah, if you say, all right, the kid left on January 5th, 2022, then that allows the other agency to put it in. You're right. It keeps me from having to do it. Thank you.
Yes, thank you for clarifying that.
Danny, you're so smart.
Pat on the back. And then another thing you had mentioned about closed pending. So our agency practices in using that in case an override is needing to be done. Our supervisor is busy also, so it does take time for her to follow up with that. Is that still okay to use for now?
I don't think it's useful, Deanna. I think I would go to the place right before that, because once it's closed pending, then you got to do a data change request. If you don't do closed pending, your supervisor can still look at it and say yes or no to it. But I guess, all right, so what you're saying is, do we want to override it? What you can do is, you know what the algorithm's going to be. You can look at it and then say, all right, this kid, I don't know, is going to screen in. And I think that's my advice, is just use that in a way that it says, all right, I don't think this kid's going to screen in. We're going to be ready to override and talk to your supervisor about it. So it's not like the closed pending can't be used, but it creates an extra step for you to do a data change request.
Okay, sounds good. Thank you.
Thanks, Deanna. It's good to see you.
Nice seeing you too, Paul.
All right, so we are over time. And I think I've actually got another meeting I got to head to. So you guys know how to get a hold of us. Thank you for taking the time to be with us. Thank you for everything you do, and we will talk soon. Goodbye, everybody.
Thank you.
See y'all.
See you.
Thanks.